But we do have some longitudinal studies that estimate when we're talking about, persistent, chronic, severe mental illness, which is what people often picture when they think about being mentally unwell, is about 2 to 3% of the Australian population over their lifetime. So that's a significant percentage, but if we're looking at people who will have mental health problems, it's about 45% across the lifetime. And about 5% across any 12-month period. So it's a really significant section of the population, and which means that it is really important that we don't think of people with mental health problems as being other or different to us, because if we do end up in that situation ourselves, it's going to be a lot harder to cope with.
Well, welcome to the Changing Lives podcast, everybody. Today we are talking about something I don't know if you can get any more crucial or critical of a topic to talk about for frontline healthcare workers. Mental illness is not only something that's on the rise and something that we're dealing with in the public, in the community, more and more so on a daily basis, but also something that healthcare workers are at greater risk of, even in the last 12 months. Today, I'm really excited to be talking to my guest, Angela Driscoll. Angela, thanks so much for coming on the show.
Absolutely my pleasure. I think this is such an important topic for healthcare workers, for everybody.
Yeah.
So I'm really pleased at the attention that's being paid to it. So thanks for having me.
Yeah, no, it's a privilege to have you. Some of our team here have worked alongside you in the nightlife precinct up at Surfers Paradise, which I think is the party capital of Australia.
It looks like it on a Saturday night.
Absolutely. And you're in the thick of it.
Yeah.
You have coordinated the chill out zone for 20 plus years. Yeah, and that's quite a unique initiative, isn't it?
Oh, yeah. It's the first service of its kind anywhere in the world, and we just have the most amazing staff team in there. So for people who aren't familiar with it, we offer, first aid care, intoxication care for people who've had too much to drink or maybe used drugs that didn't have the effect they thought they would have. And just like, I suppose, anything that can go wrong for the patrons in the nightlife precinct. So we do see a lot of mental health issues, a lot of upset people, certainly a lot of first aid, and we feel really fortunate to be part of that, and it's been a huge learning curve because, as I said, we're the first of our kind, so there's really nowhere that you can learn about how do you make sure that people feel comfortable to be getting assistance from you, and I, particularly with the staff that we've got, we have the most amazing reception there from all the patrons, the venues, the police, and it's a really, really unique service.
Incredible. And okay, so we're going to get into the what is mental health, how does it present, what are some of those contributing factors, and how we can, as healthcare workers, how we can better serve the community, recognising these, and this being on our radar to better help the community. But we're also going to get into how do we help ourselves, because as I said before, even in the last 12 months with the pandemic, the world seems to be changing and accelerating at a rate that is just unprecedented. And it means that us on the front lines of dealing with issues and health issues and emergencies in the community, that mental health is something that we absolutely got to be tuned into, not only for them, but for ourselves.
Yeah.
So we're going to get into that today with you.
Yeah, and I think in terms of language, it's changing now, but often when we think about mental health, we think about other people and mental health problems and disorders. We've really got to get into using the language that mental health is something that we all have, in the same way that we've got physical health. The conversations around that, there's lots of things that we can do that support that, just the same as in physical health. We can have one event that totally shatters our mental health in the same way that we can have an accident that shatters our physical health. And it really is in exactly the same way as physical health. It's an entire spectrum, from healthy to really, really unhealthy. We are all on that spectrum somewhere, and we'll all move up and down that spectrum across our lifetime. Right. And I think particularly with not just the pandemic, but that's a huge thing. The world is really changing really, really rapidly, and change is often what fuels mental health challenges, and whether that's a natural change, like, growing up and leaving school, getting married, having a child, losing our parents, changing jobs, they're all changes, and they all will pose challenges to our mental health. And particularly, you've really hit the nail on the head when it comes to emergency services particularly. Their interface is so important. And I think, most paramedics would say a large part of their workload is in fact dealing with mental health crises. And even when it isn't dealing with a crisis, it's also about how do we approach and work with this patient so that we're able to give them the help that they need. Because obviously paramedics have a wonderful reputation for trustworthiness and being good with people, but they have a job to do as well. So the easier that they can make that job by maybe understanding where someone's coming from or what's the best way to approach them is really important. And I know that we are going to talk as well about, the mental health of first responders, because obviously, particularly in an emergency situation, of course, that is going to affect people's mental health and the way that they view the world. And, we want people to be as healthy as they possibly can, particularly in those sort of vital roles. So I'm really glad that, we're going to talk about that.
Such a good conversation. I'm like literally, I couldn't be more excited to talk about this because I think, there has been a stigma to mental health. But we need to blow that stigma out of the water. And it's almost like, I get this feel like I've taught first aid for about 10 years. And right in the early, when I was learning first aid, it was kind of all about the physical trauma, the St. John's first aid course where you learn how to do a tourniquet and you learn how to, and
stop
it's
that
sort
bleeding.
Yeah, exactly. Yeah. And then it sort of progressed into more of the sort of chronic disease, heart attacks and diabetes and supporting people for, emergencies of that nature. But now I notice there is a bit of a new wave of mental health first aid. So there's been that progression.
Accredited courses, in that, or even just, simple courses, because it is so vitally important. And I think we've been really fortunate in the chill out zone because obviously if you're dealing with people who are intoxicated, you've already got that barrier that they might have to treatment. They're not necessarily sitting there going, oh, my leg's bleeding, can you help me? They might be combative, they might be upset. There's got to be ways around that to be able to then give them the physical assistance that they need.
All right, so before we get stuck into that and the content, can you give us just a brief background of your career and how you got into this field?
Oh, for sure. It's a twisty story. I was originally a teacher. And I worked in special education, specifically with conduct disordered young people at a school in Sydney that was only for young people who weren't allowed to go to other schools, usually for behavioural reasons. And I got really fascinated with their family dynamic, those of them that had families. So I ended up as a family support worker and counsellor and a youth worker. And I said I loved youth work. And then I actually started in the chill out zone as one of the support workers, and I was just so fascinated by this, very new to me strategy and the importance of it, and I've been there ever since. And it's always changing. It's a very political field in some ways. Our work doesn't necessarily change, but the political approach to nightlife precincts, to young people and their drinking, that does change quite frequently. The legislation will change. But I think it's still the young people that are the real pull of that service for me. It's such a critical time. Most of our clients are between 18 and 21, but we do get, very young and very older people as well. But the majority are in that, really important transition between leaving school and deciding who they are and who they're going to be. And obviously it's quite the Australian tradition to be going out dancing and drinking. So there have been changes over the time, but really at its core, it's about young people looking for their identity and where they belong. And I actually feel really privileged to be part of those moments. A lot of it is very, very funny, as you can imagine. Drunk people can be quite funny. But a lot of it is, really, really heart-to-heart talks with people in ways that they probably don't talk to anybody else in their lives because their guard's down, they've been drinking, they're not coping with something. So I think that, their humour, their positivity, their optimism, or those things to me are just such wonderful things to be a part of. I think it keeps us all young, all the staff in there, because I wouldn't say every generation's the same, but growing up is the same. And that's what we're sort of privileged to witness and be a little part of. And I think that's fantastic.
20 years, though, 20 years in that coordination role at Chillout Zone, like, how do you keep going without getting burnt out? And what is it really that inspires you about helping young people? Some would say that they're out there drinking, they deserve what they get. What is it that keeps you going?
Yeah, and I think that's definitely an attitude that people have until their own children are 18, 19, 20, and then suddenly they understand. And we certainly find that, with schoolies each year, when we have decision makers whose children are going to schoolies, decisions are made differently because it's very easy to say, that whole nightclub crowd. But when you love and care about one person in that nightclub crowd, it personalises it for you. And in the beginning, I think I didn't know what I was doing. We knew what the service was, but I don't think I ever realised at the time what an incredible service it was. It was just, I didn't know it was the first one in the world for about the first 10 years. And to be able to contribute to public discussion around young people and those transition points around drugs, around the availability of alcohol, it's really easy to demonise things like that. But it's much more important to understand maybe what is the imperative for young people. Why would they choose to do that? Why are some people affected for the rest of their lives by their decisions, and other people, grow up and grow out of it and they're all fine. And I think that's what keeps it really fascinating because it's nothing that we have answers to yet. It's about, being able to keep safe each cohort that comes through. And they are, that even the difference in young people, the way they dress, the way they choose to party, but the friendships and the growing up have been the same all the way through, which I think is really lovely. And I've got staff that have been with us 13, 14 years.
Wow.
And it's not easy to work weekends. They don't finish till, 4:30 in the morning.
Yeah.
And that can really affect your lifestyle enormously. But I think they share a similar motivation. It can be really challenging, but it can be really fun. We have a fantastic team, and that makes I think for all of us, that makes the hugest difference because you've always got someone that you can talk to if something doesn't sit okay with you. Yeah.
There's got to be a reward that is intrinsic to that role, like you're talking about, for you and your staff to stick at it that long. What you get back seems to be more than you'd say get back in an office job over 20 to 20 years.
Oh, definitely.
Right?
And the challenge of it and being able to be an advocate for young people over and over and over, whether that's, on site with the police or the ambulance trying to get them into an ambulance, or whether it's sort of, when in political meetings when we talk about the way that nightlife is managed and regulated. There's a proportion of young people that don't participate in the nightlife, but there's quite a significant proportion that participate 3 nights a week, and they're the ones that we do get to know over a period of a few years, and then they grow up and grow on to do something else.
Yep. So we want to dive into now mental illness and mental health. As we said, there's good and the bad. Mental health has a stigma of a negative stigma, right? But mental health is actually something positive as well, that given the focus in a positive way, we want to talk about some of the good practices that we can implement to keep ourselves as best we can in a positive mental health state. But, when we talk about mental illness, what are we talking about? Maybe somebody would have that stigma of somebody in a psychotic episode, but it's not that, is it?
No, I mean it's difficult to ascertain exactly, but there are a couple of ways that in Australia we look at the prevalence of mental health. There was another very big physical and mental health survey meant to start in 2020, but maybe 2020 being what it was, perhaps it hasn't started yet. But we do have some longitudinal studies that estimate when we're talking about, persistent, chronic, severe mental illness, which is what people often picture when they think about being mentally unwell, is about 2 to 3% of the Australian population over their lifetime. So that's a significant percentage. But if we're looking at people who will have mental health problems, it's about 45% across the lifetime. And about 5% across any 12-month period. So it's a really significant section of the population. And which means that, it is really important that we don't think of people with mental health problems as being other or different to us, because if we do end up in that situation ourselves, it's going to be a lot harder to cope with. So in Australia, the most common mental health issues are anxiety disorders. So I think it's about 15% of Australians across their lifetime will develop anxiety-related disorders. The next is affective disorders, mood disorders like depression, bipolar, and then substance use disorders, obviously particularly alcohol and drugs. And quite often they will co-occur in people. People with depression will self-medicate with alcohol and not realise that that's actually making both problems worse for them. And, the big elephant in the room, which is being talked about a lot more now, we have every day in Australia 6 Australians who take their own lives. And that is absolutely, just a crushing figure to think about. And we have, I think, 65,000 that make an attempt. And that's certainly males are much more likely to die by suicide than females, for a couple of reasons. Probably the one that gets around the most is that they will choose more violent and final means when they do take that step, whereas women are more likely, to choose softer means. I don't mean, softer as in not as likely. So, they might take an overdose of pills rather than jump off a building or hang themselves. And I think also what tends to co-occur with that is that males, it's still socially not as acceptable for males to talk about their feelings as it is for females to seek out a support network and say, this is how I'm actually feeling. So we have probably across most of the Western world, but certainly in Australia, this stoicism that, men aren't allowed to have feelings. And that's changing quite rapidly. We have men's movements and specific mental health support groups for men, and I think that's really, really an important factor, is that, women seem to more naturally have support networks or be able to talk about how they're feeling. And, that's something that I really hope to see over the next few years, that we have more males that feel comfortable doing that as well. And certainly culturally, there's lots of different things, lots of different issues that will cause distress for people. But that they are coming out into a more open conversation right across the country is really, really important, particularly when we're talking about things like sexual assault or toxic masculinity, where we there is deep-seated trauma there. And once we can start having those conversations that acknowledge that, these are extraordinarily traumatic events for people, that's when we can actually begin to address not just the effects on people, but how does our culture support these sorts of things? This stoicism with males, or, the self-blame that might come with sexual assault for people. And, the suicide is the number one way to die for Australians aged between 15 and 44, which is terrifying. And quite often there's different schools of thought around suicidality, but the one common stream that people who contemplate suicide or who recover from a suicide attempt will say is, I didn't think anybody would miss me. I didn't think I mattered. And having been involved in the aftermath of quite a few, I've never, ever been involved in one where people didn't care deeply and were incredibly grieving at the loss of a person because they'd never told them. And I think that as we start talking more about these are ways that you can feel and these are normal ways to feel, and you need to reach out, particularly before it gets to a crisis, but definitely when it gets to a crisis. So when we were talking before about mental health first aid and strategies around that, there's certainly a lot of different learning opportunities to find out how do we talk to someone that when we're concerned about them. And for years it was, don't mention suicide, or they'll kill themselves.
Yeah.
And now the thinking is really, really clear. Ask straight out, are you thinking of harming yourself? And say, I am worried about you. I don't want that to happen. What can we do together to get you help?
Yeah.
And that's not, when someone's at that crisis point, if you notice that they're behaving differently, they're withdrawing, they don't seem themselves, ask, if you care about them. Obviously, if they say, give me space, give them some space, but make sure that it's not at the expense of them knowing how much you care about them. That we do have a lot of strategies that are trying to address suicidality in Australia, and I think that's really important. And we have a lot more that are trying to make sure that people don't get to that stage. So we know that mental health is a challenge for almost half Australians across their lifetime, and that certainly doesn't exclude anybody. Any of us could suffer a traumatic event that really impacts on our mental health. We're talking more now in our society about as we grow as children, what effects do traumatic events in childhood have on us? And that can be something as commonplace as our parents divorcing, which some people would breeze through and not find traumatic. Other people will blame themselves and internalise that, and there's something wrong with me. So as they grow into adulthood, they still have that core belief there's something wrong with me, or that wouldn't have happened. So we're, I think, much more careful socially now to try and involve children, when relationships finish, to try and look at ways that parents can mediate around that co-parenting role, because we recognise now how the disastrous outcomes can be from something that's quite commonplace. Any of us could be involved in a car accident, that is traumatic, or, the sudden death of someone that we care about, and that's traumatic. And when we talk about health professionals, and that's part of their role, is to enter traumatic experiences. So I think it becomes doubly important to make sure that, how do we take care of ourselves so that when we do come up against a trauma, we are as resilient as we can possibly be to that trauma.
Yeah. All right, so let's talk about the prevalence of mental health issues. Are rates really growing, and what's contributing to that in your experience?
Yeah, that's a really good question, and it's difficult to answer because we've got a number of survey instruments. Some of them are self-report, so how do people feel? And that's certainly growing. And we've got a growth in people that are being diagnosed with mental health issues. So definitely part of it is we're talking about it more, and we recognise that, but that is only a part of it. I think most mental health issues in Australia will come when people are in late adolescent to early adulthood. So sort of, 15 to 24 is the most likely onset for most disorders. And what we know about that period is it's an enormous transition period. So even a 30-year-old thinking back to when they were 15, the world is a different place. Our access to news, our access to each other. I'm old enough that I remember when you had one family phone in the lounge room, and if anybody wanted to talk to you, that's how they had to talk to you. Yep. And now young people can be, absolutely bombarded from all sorts of different directions in terms of messaging, which there's two issues that come with that. One is that they don't have the same amount of time that, say, 20 years ago we did just to be ourselves and to, to not be in relationship with other people or, communicating with other people. And also the way that people communicate, particularly online. I think everybody realises that many people communicate online in ways that they never would in person.
Absolutely.
Malicious and nasty, and say things that they would never say in front of their mum, but we feel that, that anonymity online allows us to do that. Some of our most tragic cases in Australia have been specifically linked to online bullying and the capacity of young people to reach vulnerable people 24 hours a day. And And, many of those young people who are affected will say, well, it'd be even worse if I couldn't respond or I didn't see what was written about me. And as much as parents might, try to manage that, it's also really, really difficult to understand if you didn't grow up like that. And when we're talking about adults and young people, our access to news, 20 years ago, one nightly news bulletin, and you could watch that. And now, the sources of news that we have and trying to decide whether they're valid sources. Are they representing the truth? Is there other things that are being represented there? It's very, very confusing. And I think it's enormously challenging for young people to navigate all those different worlds because they can't really necessarily talk to their parents about them because their parents don't move in the same worlds and can't necessarily talk to each other about them because there is this real, I suppose, an idealised view of how their lives should be. And now there are wonderful conversations starting around that, in terms of, do we follow Instagram influencers and are they, a lot of them are coming out and saying this is not what my life looks like, this is what my life looks like. And I think that's really, really important. Even the changing attitudes that we've had to the LGBTQIA plus community in the last 10 years has been phenomenal. And there'll come a time in 10 years where we can't even imagine that people in that community don't have the same rights as other people. And that's really, really important when it comes to mental health because the suicide rate amongst young people in that community is 4 times higher than people that identify as straight. And so to be able to have those conversations and to open up socially, there are difficulties that come with it because obviously we've got quite conservative views linked with very liberal views. But if we keep those conversations going, that's what is going to help us and keep them going in a helpful way. I think is really important. So. In terms of prevalence, I think it's kind of like a perfect storm. We're talking more about it. People are recognising that, okay, maybe things aren't fine with me, seeking help or identifying that, yes, I have an issue. We know that only around 50% of people who probably have a diagnosable mental illness are seeking treatment for that.
Wow.
And that's specifically based on Australian data. The Black Dog Institute's got some wonderful data around that. And we also know that of those who do seek treatment, about 75% will have a positive experience and get significantly better from that treatment. We don't have any shame. If I cut my leg, I've got no shame in going to the hospital and saying, oh, I really need some help here. I need your skills to help me. But we still seem to have a bit of a stigma around that when it comes to mental health. And that's what conversations like this will actually change eventually. That it is really, really important to talk about these sorts of issues in our own circles, publicly. How do we address, so there isn't that stigma that comes with them any more than there'd be a stigma that, I had asthma, which I don't. There's no stigma attached to that. There's no stigma attached to catching the flu. Yeah. But there's an enormous stigma, if you are depressed or if you are anxious. And I think there's far, far less than there was. 50 years ago, anybody indicating psychotic behaviour would probably be locked up for the rest of their lives. Now we know that there are ways to manage those symptoms. There are very, very few cases, and probably going back to that 2 or 3% we talked about before, where but a percentage of them probably will not be able to participate fully in society, but a significant percentage of them will with the right assistance. Okay. And whether that's medication or ongoing therapy, a combination of those two things, taking care of yourself as well is enormous. There is no barrier to participation in society except in very, very rare cases. And that's part of the stigma. People think, I will always have that label. And the medical community certainly come around. That label is to allow us to assist you. It's not just for the sake of having a label. It just helps us better understand what we're dealing with. So, I think that prevalence is a vexed question. It's hard to answer. And whether or not, just, I suppose, the evolution of our society and of our culture, whether that is just a breeding ground, the rapid technological changes. When we think back, 100 years ago, the world was an unbelievably 10 years ago, the world was an unbelievably different place. And the pace of that is so rapid that we probably, it's challenging to then say, how do we support people in these transitions, whatever their transition might be, to not feel so alone? Because realistically, a lot of us feel, if we may be incredibly electronically connected, but that doesn't mean that we don't feel alone. And there's been recent studies probably brought on around the pandemic that, loneliness is at epidemic levels. And I think there was real concern initially when the really harsh lockdown started with the pandemic that, the suicide rate would spike. And it's been shown that that's not the case. Help seeking has spiked incredibly. People contacting Lifeline and Beyond Blue and Kids Helpline to say, I'm feeling really isolated or I need help. And one of the factors in that, I think, and I'm sure that there will be research that looks at that, is, if we are all in this together, which in the pandemic we definitely were, then I am not isolated. I have connections to other people. We're all suffering together. It's not just me feeling like this. And I think that certainly in the early stages of the pandemic where, everything was locked down, we really did start thinking about, what do I value? Yep. It's not being able to duck into Coles and buy toilet paper, if you could. It's, the people that I can't see, they're important to me. Yeah. The value that I place in my work and how that makes me feel, that's important to me. And so it really did set the scene for a while there on being able to open up conversations that we've never really had before. And I sincerely hope that a lot of that stays with us as we come into sort of a post-pandemic world. What is important? What did we miss? Our horror at not being able to visit our elderly citizens in nursing homes. Yeah. Hopefully that will then have an outcome of much more frequent visits because it's important.
Yeah, it's the typical, don't know what you've got till it's taken away.
And I think, we all paid so much attention to that in those few months for Queensland anyway, with the really hard lockdown. I'm sure Victorians really, really had the opportunity to think about it and what do I miss and what gives me joy. Yeah. And, we can only be better because of that is my really sincere hope. Yeah. And even in terms of, this is not just in my country or in my state, this is across the world that people are grappling with. And I think that, there'll be a lot more understanding that we are a global community. Yeah. It's unfortunate that it was a really rapid spreading disease that had to do that for us, but it just goes to show how connected we all are.
Yeah. All right. So as a frontline healthcare worker, a first responder, you've got plenty of experience in that. What are some of the signs and the things I'm looking out for to recognise whether somebody is having a mental health episode, and then how do we respond to that?
Oh, I think firstly, some will be very, very obvious, that they are detached from reality, that they're seeing things that aren't there or hearing things that aren't there. That's in the most extreme case. So someone who is having a psychotic episode will be really detached from reality. The newest thinking on that, or it's not that new, but is don't argue with delusions, because you can say that's not real, there are not dragons across the road. But that doesn't matter. If they're real to that person, then it's a much better approach to say, why don't we go over here then, away from the dragon? You're not going to, reinforce their delusions necessarily, because they don't need reinforcing. To them, that is really, really real. But if you need them to come with you or to accept treatment, then that sort of approach where you accept them exactly as they are in that moment, even if you logically know that where they are is not a healthy place, and you get that really quickly reinforced in places like the chill out zone, because you are dealing with people who are alcohol and drug affected, so their reality is already distorted. They may be with 4 of the most fantastic, supportive friends that you've ever seen, but they absolutely hate them at this point in time and know that you never do anything for me. So that's the reality that you have to deal with. If that's the person that you want to assist in some way, then you kind of have to log into their reality to make that connection with them. Certainly if we're talking about suicidal.
That sounded like perfect parenting advice as well. The monster's in the cupboard. I'm just going, I should just go along with it.
Yeah, because they believe that.
Yeah.
Or you could go along, yes, there were, but I got rid of them because I'm your dad.
Right.
And I can beat anything. Yeah. Monster spray.
So thank you.
There's a take-home piece of advice for everyone. And that's really important. Obviously, people who are suicidal are significantly at risk. And if we're, talking to someone, probably for first responders, we've got there because they have said something to somebody or made preparatory behaviours to harm themselves. But if it's just, you're not quite sure, you can listen for clues. What are you doing tomorrow? And if they don't have any plans for tomorrow, that's probably not a good indicator. If they say things like, I don't want to be here, I don't want to wake up, that's not active suicidality, but it is passive suicidality. I don't want to be here. And as we were saying before, really important to ask concrete questions. Have you thought about harming yourself? Is this something that you would do? How can I help you so that you are safe? The most important thing to me is that you are safe. Who can I call for you? If you haven't access, if you're working as a health responder, please come with me. We can go to the hospital where we're able to assist you in getting some assistance, because I'm sure that you are really valuable to the people who care about you. And be prepared for people to argue with you. No, I'm not. No, I'm not. Everybody hates me. I'm sure that's not true. Who do you live with? When did you last talk to them? And you can tease out clues that prove to them that there are people that care about them.
Yeah.
Suicidality is the biggest risk, that if we don't pay attention to those sorts of clues and never be afraid in any situation, whether it's a personal one, a professional one, especially if it's yours. Listen to those clues and make sure that person does seek support. If we're talking about, when we've talked a bit about psychosis, if we're talking about people who are maybe depressed or anxious, we get a lot of people in the chill out zone who are having anxiety attacks. Many of them have had those before. And the most wonderful thing that you can do is validate that, what do you use? What have you been taught that helps you get over these periods?
Right.
And for some people it'll be, I tap, I practice mindfulness, I regulate my breathing, I meditate. Great, well, let's do that. Can I do that with you? If it's people that have never had an anxiety attack before, the physical symptoms can be frightening, and it's important to remember that people who are having an anxiety attack or a panic attack truly believe they're going to die. Their heart is thumping, their fingers are tingling, they can't breathe properly, they don't know what it is. The mind is an extraordinarily powerful thing. So I think it's about, learning about what different disorders are there and how might they present to people. So you can have people who are presenting as suicidal who have no intention of harming themselves, but the feelings that they have make them say things like that and perhaps act in ways that are really concerning. So I know that a lot of, for some young people, their families or their support people go, well, this happens every week. It doesn't make it any less valid. It doesn't mean that it's just a cry for attention. But certainly if something, whether it's a panic attack or suicidal threats, if something is occurring, even just once or twice, that's a really good time to say to someone, I'm concerned. Did you know that 45% of Australians will have a mental health issue in their lifetime? Do you think this is what could be happening here? Why don't we go and see a GP?
Great, yep.
A lot of Australians now, I think, know about mental health plans that are accessible through GPs.
Yeah.
For young people, Headspace arranges all of that, in one place. But even if people don't think that they have a mental health problem, those mental health plans can be wonderful to be able to talk to somebody that's unbiased, that isn't involved, that can, give you some of the feedback that does help you to cope. Because with a lot of mental health issues, there's a lead up that whether it's a traumatic event or something that we just don't recover from. The death of someone close to us is a really good example of that. There's a normal and natural grieving period. If that becomes prolonged, if it's something that interferes with our daily lives after a period of time, then that's a good time to say, okay, I'm not coping. What can I do that would be helpful? Or, to observe that in someone else. What can they do that is helpful? And I know that for paramedics particularly, it's an enormous part of their workload. And the most important thing for I guess, the right outcome, and that our most important principle in Chill Out Zone is not to judge people, to be non-judgmental, whether that's around the behaviour they're exhibiting, the things that they're saying, even if they're calling me names, or it's around the drugs that they might have taken or the amount that they've drunk. That isn't really our business. Their safety is our business. Yeah. And the only way to ensure their safety is for them to feel that is your main motivator, that because whatever decisions we might have made that get us into a situation, thinking about them is probably not going to help us get out of it. So the most important thing is, where are you at right now? Where do we need to be? How can I keep you safe?
Great. Now, how do you keep yourself safe?
That is also extraordinarily important. And that's for everybody, to be able to say, well, what are the factors that impact on my well-being, and how can I make sure that I do the most that I can? So we talked before about, prevalence across a lifetime, and a huge thing is being ready. For whether it's a traumatic event, if you're working in healthcare or, working with people who are in difficult situations, you are certainly more vulnerable to taking that on. And one of which fantastically we're talking about now, much more around PTSD and other trauma disorders that do happen to first responders. And I know there's a lot more emphasis now on the prevention of those. And we talked before about, the correlation between physical health and mental health. It really is exactly the same. We know that there are things that we can do that improve our mental health. Some of us do them really well and some of us not so much. But, we can eat well, we can sleep well, we drink water, we exercise. It's exactly the same for mental health. There's been remarkable progress in looking at the actual linkages between our body systems and our mental health. That enormous amounts of serotonin are produced in our gut, not our brain. So the physical aspects of health do also contribute to positive mental health. Doing things that we love, acknowledging when we're in moments that give us joy. Parenting is it's a double-edged sword, because there's lots of moments that give us joy, and then there's other moments where we think, I'm going to rip my hair out, I can't deal with this. But to really try and savour the beautiful moments of it. And that can be, even if you're not a parent, that can be anything. What am I good at? I'm going to try doing that at least once a day so that I do get that feeling I'm good at this. And, when we talk about exercise, it's certainly not for everyone that we're going to go out and not for me, go out and work at doing a triathlon. It can be as simple as walking around the block. For me, it's swimming. To be in the water is incredibly restorative for me. I'm from a big family. Contact with my family is really important to me. It's not always positive, but it's really important. So being able to, and because a lot more people are thinking about this than ever have, they're able to identify, what gives structure to our lives, what gives us joy, how can we have more of that in our lives, what's important to me. And I think that, we're able to do a well-being plan for ourselves. And if we're able to do that and to follow it, we're in a much stronger position when things do go wrong, because things invariably will go wrong in life. Eventually most of us will lose our parents. Many of us will go through other traumatic experiences that we didn't see coming. The more care that we've taken beforehand for our mental health, the better we are going to be able to cope with those things. And it can be, I think the last 12 months has been stressful for everybody. So much change that, we've all probably been really looking at how do we assist our mental health. and you think of, I know that it happened across the world in the end, but I think it started in Victoria, the bin night. Where people got dressed up to take their wheelie bin out because it was the only time they left the house. Yeah. Things like that where that can be, everybody, lots of people were doing it, lots of people were watching it. It was hilarious, and something as simple as that can be really good for mental health. So it doesn't have to be huge things, but they've probably got to be regular things.
Yeah.
Some people find great comfort in religion, in their belief system. Other people don't have a religion, but they're still going to have a belief system. And, to think about what that might be. And it can be as simple as saying, my family give me strength. That's a belief system. So make sure that you contact your family. Pride in our children, pride in ourselves when we manage challenging moments with our children, that's really important. Nurturing relationships that nurture us right back. All of which sound really simple, but are often the first things that we forget when things get difficult.
Yeah.
Like, oh, well, I'm not going to eat breakfast today.
Yeah.
I can't be bothered showering today because I'm not going anywhere anyway.
Yeah.
That they're simple things, but they're things that are worth paying attention to. And that's why I think there's so much popularity around things like mindfulness now, because, when people first talked about that, it was like, oh, that's kind of a spiritual practice. It can be a spiritual practice, but it's grounded in really good science around, the plasticity of our brains, and that we can actually create for ourselves the lives that we want, despite what what external circumstances might be. We don't always have the capacity to change external things, but we can always change, our internal workings and our belief systems, and that's really important. And particularly, we know that there was a proportion of the population naturally in the helping professions that continued to work, through the lockdowns and when everybody else got to work from home. That's when it becomes vitally important that people are aware of the value that they hold, even when, and I know in the healthcare professions, it's really common to not feel very valued, whether that's the way that your patients talk to you or the way that the system works. So the importance then of making sure that you value yourself, but also the colleagues that you work with. How do you let them know that you value them? Because that is one surefire way that then you're going to feel value as well.
Yeah.
Because hopefully they'll say the same sort of things back.
Yeah, absolutely. So it sounds like to me that there's this real need to be very, very intentional about how we look after ourselves mentally,
and
our mental health. And
that's a perfect phrase to use, I think, because it's not something that is intentional for most people, but they are generally things that we're doing anyway. When we are well, we do nurture ourselves. We do seek out the things that we enjoy, and we do say to ourselves, "Oh, you're doing a good job there." But all of those things are the first things to go when we don't feel so good about ourselves. So that intentionality does become really important. I was telling someone the other day that my daughter left home to move to Sydney for a fantastic opportunity when she was 20, I think, and she and I were very, very close. For the first 2 months after she left, it was such a huge transition for me. I actually had like a self-care star chart on my wall. To reinforce to me the importance of that. And it's not like I was, really young, but it really, really worked for me.
Great.
Because it was like, let's identify the things that you enjoy that are important for you. And it really helped me. Like that for me was not traumatic, but it was such an enormous change that suddenly, which I think any parent whose children have left home would relate to, it's this it's the centre of your life for 20 years or however long. I believe 30 is the current age to leave home. How do you feel that when that is gone? Because it's not something that most of us contemplate. When you're in the middle of it, it's like, this is going to go on forever.
Yeah.
And it doesn't. And I think, recognising those transitions and being proud of the things that we do, particularly as parents, those are our most fundamental and probably most sensitive relationships that we're ever going to have. But whether that's, I finished school, even if you didn't do well, you finished. And for the students at APC, started this course. I did something for myself,
Yeah.
something that's important to me, and I've gone out and done it, because not everyone will. So really celebrating those little wins, and I think that's a perfect word for it, intentionally. How do we intentionally build wellness into our lives?
Excellent. And you talked about this well-being plan. Is there some sort of structure that somebody can? Is there something out there that we can follow to do a well-being plan, or if not, what does it look like? I mean, how would you?
I think that there probably are, and we'll have a look for them, because we can make sure that they're posted. But thinking what are the components to well-being? Well, it's physical health, it's mental health. Physical health, most of us know what are the components to well-being. It's whether we do them or not that's a different story.
So, and again, we're saying that those components of physical health are also shown to show improvement for mental health as well. The same thing. So we're talking about exercise, regular exercise. You don't have to slog it out for 2 hours a day.
No,
in the
walk
gym.
around the block.
Walk around the block. Which also could be one of your things that make you feel mentally good as well. I mean, that's what we're saying, right?
Yeah.
And it's good nutrition, water, rest, sleep. I know for my own personal mental health, that sleep is absolutely critical. Getting a good night's sleep consistently is like one of the the best things I can do to feel like I'm winning.
And that's one of the reasons, that very early parenting is so difficult, because the one thing that you can't get is a decent night's sleep.
Yeah.
And the effect that has on mental health is enormous.
Yeah.
Looking at ways, I guess, to get back to that idea of intentionality, if you're walking around the block, what are you thinking about when you walk around the block? And rather than thinking of all the things that went wrong in a day, set yourself up to actually think about the things that went right.
Yep.
The added dimension, I suppose, of mental health is when it, all the things that support our physical health also support our mental health. But our thoughts will very much shape mental health. And that's when things like mindfulness will come into it, just taking time to really pay attention to minute things in our day that we wouldn't really. And to try and feel gratitude is a huge one. What are we grateful for? And often the things that we're grateful for are such a huge part of our lives that we forget that we're grateful for them. Whether that's children or our health, our friends, our families, to actually concentrate on what we feel gratitude for. And, there've been some really remarkable studies done with people who are under care for mental health reasons, and things like gratitude journaling and mindfulness have been far more effective than than pharmaceuticals by themselves. And these are things, we don't need anyone else there to journal. We don't need anybody to tell us, what are the 3 things that you're grateful for. Reaching out, and they can be actually telling those who are involved, and really simple. It doesn't have to be big things, I'm grateful when you smile at me when I come into work every morning, because it makes the day get a bit better. To share that gratitude is another really important part of a wellbeing plan, to actually communicate with people why we're grateful, to why they're important to us. And one of the harder things probably is meaning. How do we take meaning from life? So for a lot of people, that is built into religious beliefs, what the meaning of life is. But we know that an increasing portion of Australians don't subscribe to a particular religion. So thinking about what gives your life meaning. Is it the relationships? Is it meaningful work? Is it work that you do in the community or volunteering that you do? What's a cause that you're passionate about? How can you help in that cause? And that could be just reading a lot so that you understand it really well, or it could be activism in the community. But those sorts of, and many of us are too busy to do those other things.
Yeah, absolutely.
So what meaning can we find in the things that we have to do? And quite often that is relationships. And, we know that one of the most difficult periods in life, well, not difficult, but certainly challenging, is that transition from childhood to adulthood. And I imagine there's lots of the students of APC that are in that age bracket, because that's about identity formation. And that's difficult because we're moving from being the child of our parents into very much being our own person. So we're making a lot of decisions, sometimes without a lot of information, being really influenced by our peers, and probably also, that process is starting much earlier. We were talking before about the sort of bombardment of news and of social communication. So for a lot of Australian young people, that's starting much earlier, at 12 or 13. And they are hard decisions for people to make. So that's important, what meaning do I have in life? Getting out in nature. And again, it's not about, doing a 10-kilometre hike. It can be sitting with your back up against a tree listening to the birds. But being out in the fresh air and in nature has been shown to really improve our mood. And sometimes, just like with the star chart, it's about forcing ourselves, about being reminded, making that habit. After 2 weeks or a month, you don't need the chart anymore because you go, that makes me feel really good. So I'm going to do that just because it makes me feel good. Yeah, so I think, that intentionality, just even if it's identifying 3 things, 3 ways. There are 3 things that we can do every day that are going to make us feel good. And it can be, getting a manicure, getting a pedicure, getting your hair done. It can be, external things. Or, every week I'm going to make a time to have coffee with a different friend, or just with that one friend because they make me laugh so hard. I haven't seen them for months because I don't have time. I'm going to make time because the intention that comes with that is this is something that's good for me. Yeah,
great. Love that. And I think the act of actually just writing those things down, like you said, having a star chart or something on the fridge. It doesn't have to be that, but actually writing it down helps you to visualize these things and keeps you a bit more accountable to making these practices regular. I know for myself, in just personally overcoming some health challenges that come with their own set of mental health challenges when you're not feeling well. Meditation, mindfulness has been an absolute game changer for me, and it's so simple, very hard to start with, just being there with your own thoughts. But the great thing is that you're not alone in that, and it only takes like 5 minutes to start to build a meditation practice. It's not super woo-woo or weird. It's just, sitting and resting and acknowledging, accepting what's going on, even accepting the thoughts that are going on in your head, but not identifying with them.
And that's actually a fantastic point, because a lot of people give up these kind of self-care things because they're like, I'm no good at that, or I tried to meditate and I just heard this negative voice the whole time. Pay attention to that. If you've said, I want to do these 10 things every day, pay attention to the ones that you're not doing. And no judgment. Why aren't you doing them? Same as if, you have an internal voice that's sort of saying, this is never going to get better. It's always been like this. I'm so hopeless. Well, where does that voice come from? Don't judge yourself more harshly than you would judge other people.
Beautiful. So definitely challenge everyone listening to, if they haven't already, put into practice some of these. Put down, 5 of those things or 3 things you're going to do. Don't necessarily have to be very long things. You don't need to cut out, an hour or 2 hours or whatever a day to do this stuff. They're simple little practices, but do them regularly, and you'll notice a big difference. I challenge you.
Yeah, and one of the wonderful things now is if you sort of go, well, I wouldn't know how to meditate, Google beginner meditation.
There's great apps out there, free.
Yep. And we'll put. I'll make sure that we have available. There's it's just a fact sheet about apps and things that are available online for people. And, a lot of them are free. A lot of them, some of them are just keeping track of what we say that we'll do, but, that are giving us support to do that. So we'll make sure that that's available as well. Because I think particularly, as we've said, for people that are entering the health profession, especially first responders, the more that they can do that takes care of their own well-being, the much better they will be at coping with the challenges to well-being and mental health that do come with of being a first responder, and they're not always patients. The system can be frustrating. Colleagues in many workplaces are frustrating as well. So how can we best get ourselves ready for those challenges so that I can actually have a long career? And certainly most emergency services are absolutely acknowledging now that, they do have, they've got peer support workers, they've got external support companies.
They do.
And we unfortunately have a bit of a history where that was stigmatised, and people thought, if I access that, people think I'm weak, so I can't do it. And that stigma has almost completely disappeared, because the reality is that it takes an incredibly strong person to say, I need help.
Yeah.
And that's what will keep that person strong, because they're not struggling. They've actually will get structure around that. And I think that's just a wonderful thing.
Absolutely. Okay, so we've talked about good practices to keep ourselves in a good mental health state, but how do we know if we're really in that danger zone now, and then where do I go to get help?
The last part of that's really easy, because there is so much help available. The first part, how do I recognise, can be quite tricky, because if we're talking about things that have formed in our childhood, or our responses to some of the traumas that we talked about before that are traumatic for children, then it can become such a part of our personality that we actually don't realise that we have those responses. So for different types of disorders, they would be very different warning signs. But anything that interrupts our capacity to live the life that we want to, because of the way that we think or the way that we behave around others, is probably a bit of an indicator that we need to look at our behaviour. And if we think, well, I don't know why, then maybe we do need to go and see a professional where we can actually say we don't know them, they're not going to judge us, where we're able to say, wow, every time I fall in love, I end up just completely paranoid that they're going to cheat on me and I ruin the whole thing. That's an indicator that we're probably not thinking in a way that is helpful to us and supportive of the outcomes that we want. When it comes to things like depression, that is something that can happen quite gradually or really, really rapidly. So things like not being motivated, not wanting to see people that we care about, not wanting to talk to people that we care about because we don't want them to know what's going on, not wanting to go out anymore when we used to really enjoy going out. Anything that we enjoy, suddenly deciding or even gradually deciding that we don't want to do that anymore. And that when we talk about those sort of transition periods, when we talk about, the finishing of school and stuff, a lot of things that come with school. So a lot of young people, will play instruments at school or do dancing at school. And for a lot of them, that finishes when they finish school, which can then mean that they're missing something that they actually really enjoyed. So, but whatever age range, some things will be very obvious. We talked a bit before about grief. So the loss, of a parent or a contemporary is traumatic. It's traumatic, particularly if it's sudden, and there is going to be a natural grief response to that for a period of time. If we don't feel that that's resolving, I cannot find the motivation or the joy that I used to have in life, that's an indicator that it's a good time to go and see a medical professional. We were talking about mental health plans before. Those are developed with us by a GP. So, we're able to go in and see our GP and actually say, this is how I'm feeling. And then all GPs in Australia have the capacity to say, okay, well, let's do a mental health plan. There's a bit of a rumour that goes around that, okay, well, then everyone thinks I've got a mental health problem. Anything between you and a medical professional is confidential. It's not going to interrupt your career or have people talking about you, because that's simply not the way that it works. So any major adjustment, it's always worthwhile to go and talk to someone unbiased. Many of us are lucky to have someone like that in our lives already, but a lot of people aren't. So a counsellor can actually, or a psychologist can actually be that person for us at particularly difficult times in our lives. When it comes to suicidality, which I think is the hugest challenge that we face, any indicator, anybody at any time that thinks, I don't want to wake up tomorrow, that's an indicator that, there is something not right. And whether that is a mental health problem or it's just a loss of motivation or joy in your own life, get help as soon as you can.
Yeah.
Reach out to people that care about you, because we were saying before, one of the really common things across people who contemplate suicide is that nobody will care. And that is so far from the truth.
Yeah.
But their thinking has distorted the way they believe other people look at them. I mean, I would say if you've got a good relationship with your mum, start with your mum. You're going to find someone that cares incredibly and would be devastated if anything happened to you.
Yeah.
And sometimes that's what we need to hear. If we've allowed ourselves to get to a point that we don't believe when we hear those things, then that's an indicator that we probably need more professional assistance.
Yeah, okay.
If we start doing, hopefully we'll start doing all those wonderful supportive things anyway. But if you feel like you're losing motivation or, you're not getting joy in things, seek out the things that do give you joy and practice them as often as you can. And if that doesn't help, then get yourself to a medical professional and just say, I think I need assistance. And it may just be that you're at a point in your life where things are going to be difficult anyway. How can you be supported through that? Or how can you be given the language so that you can let people who care about you know that you're struggling, know you are not adding to their burden. When it comes to substance use disorders, that can be really, really tricky because the nature of addiction means that we don't recognise that we have a problem. Everybody else around us does and is really concerned, but we think that we've got the answer to the problem. If I go off and use this drug, then it's not really a problem anymore because I feel great. So a lot of the time that will come from people around you saying, I'm concerned about this. And I think, that's the really tricky part with addiction. We often don't. I've got it under control. We don't listen to them. But certainly, anyone expressing concern, that's a warning sign if you care about them. Having said that, the other side of the coin is sometimes our relationships can be toxic enough that they're not helpful at all. Someone who continually puts us down or harks back to something that we did that doesn't make us feel good about ourselves, they're not good. They're not healthy relationships to be in. And whether they're, friends or partners or lovers, that's probably not going to help us or not going to help our mental health in the long term. When it comes to the helping professions, mostly what we're talking about there is burnout or vicarious trauma. So vicarious trauma is more likely to be for counsellors or psychologists who listen to traumatic events or their clients reliving those traumatic events. Most professional people will have ways to make sure that they are not getting to the point where they're not going to be able to work anymore, not going to be able to function. When it comes to, first responders, paramedics in particular, it's more likely to be something like a trauma disorder from exposure to trauma. And some people can go for years and years and be exposed to trauma after trauma and it doesn't bother them. But then it's one case, one thing that they attend that touches a nerve in them. It's really important to recognise when we have flipped over into something that's not healthy. So for a lot of anything involving children is naturally really traumatic for the people that respond, particularly if they have their own children, because that's not really, that's not the order of things. Children aren't meant to die or meant to be harmed.
Yeah.
Being able to keep track of that. If your coping mechanism is to drink a lot every night, there's a problem there. Right. Because that's not a healthy coping mechanism. And we'll always need first responders. We'll always need people that are exposed to that trauma where we have an expectation that they'll be able to cope. So it's really important that people who are choosing those careers also are choosing, how do I prioritise self-care? Not just because I'm worthy of self-care, but because I want to have a long career. Yep. And that they're able to recognise when something does affect them. And sometimes that it can just be cumulative. Nothing bothers them until everything bothers them. And to be able to recognise that. Most helping professions are fortunate in that, there is real camaraderie among colleagues, and they're able to say, no, I'm seeing things that make me concerned about you.
Yeah.
When it comes to students, just choosing to study is a really fantastic thing to do for yourself, and that's something that people should be proud of. But it also adds to stress.
Yeah.
And I know that if they're lucky enough to be an APC student, there's an entire student support staff here specifically to help with those sorts of issues. If you're not coping, can you defer? How can you cope better? What would be, you've got students from right across Australia that will go to workshops with people that they don't know to talk about confronting things. Just know that is managed in a way that recognises the importance of the student's health. But certainly if they are working full-time, then choosing to study, they're young or they're going through a transition, which quite often happens when we choose to change our career path, recognise that you're just by those choices that you're under stress. And that stress is good. Or can be good. It's getting you to somewhere that you need to go, but you need to manage that in between. And if you don't have in your personal life people that can support you in that, then you certainly have them through your college, and to take advantage of that, because that's what they're here for.
Yeah. And it's great that organisations are starting to meet the challenge, see the challenge, starting to meet the opportunity, seeing the opportunity as well. Because, I know for, say, students at the Australian Paramedical College, they are going to be with this college and for about 2 years, up to 2 years, and have significant involvement in the college and with the staff. And I know that they've put on a mental health plan now. They've got resources and things like that students get access to, because it's a very real challenge that, as we've been talking about, that a lot of us have to deal with it at some point in our lives. We will likely have to deal with these challenges. And as you said, a lot of people in this study kind of season of their life, they're coming out of school or they're changing careers, and there's a lot of change happening. And these are the potential danger zones that we need to be really, really, gracious with ourselves, intentional about our mental health. And I think, I think we're moving in a positive direction. Even this conversation today is a really positive thing, and I'm just so glad that we're starting to talk about and make this a priority, make our mental health a priority, not just talk about it in a bad light as well, a negative light, like what does mental health look like? Do I have one? All this sort of stuff. But hey, being on the front foot, making a plan.
And certainly, workplaces, there's a recognition now that well-being in workplaces is vitally important. It's an enormously important component of workplace health and safety.
Yeah.
We only used to talk before about manual handling or injuring yourself. Now we're talking about stress and the environment that we work in, and the importance of kindness and respect amongst our colleagues. It's not just about, the old scenario of bullying, of violent hazing or, violent behaviour. It's about the way that we're made to feel in our workplaces or our study places. And I think that these sorts of conversations are only going to contribute in a really positive way to people going, well, actually, it's really important to talk about this because I want to have a long career, and the only way to have that is to take care of myself and to recognise when I need help with that. So I think we'll make sure that, though, that resource fact sheet, all of which is online, and it's, everything from anxiety to eating disorders to self-harm, really specific apps and support programs for wherever people may identify that they may need more support. Yeah.
Great, Angela. Well, I think we've hit everything that we wanted to today, but I do have some final questions that the Australian paramedical students have asked if I can bring to you, but easy ones. There's not too many.
Good.
And we may have covered a lot of these, but what are the best practices? We've already covered those things, right? Best practices to support good mental health. We've talked about that a lot, which is great. But in a nutshell, What are these good practices we talked about?
Sleep.
Yep.
As well as you can. Eating well, drinking water, exercising, getting out in nature, being grateful, being mindful. What were some of our other ones?
Relationships.
Yeah, valuing our relationships,
Yep.
and patting ourselves on the back. When we do have a win, no matter how small it is, that that's an achievement.
Excellent. Okay, how can we break the stigma associated with mental health?
I think conversations. We already are, and it's the sort of the ripple effect of the widening out of those conversations, so that when we talk about mental health, we talk about it in the same way as physical health. Everybody's got it. Some people are very healthy, some people are not healthy, most of us are in between. So to really, because usually in the past when we think about mental health, we think about people who are unwell. But when we talk about physical health, we immediately think of someone who's buff and strong, and so it's a really interesting way that we've framed those two things that are really very, very similar. So I think conversations is the answer to that. That when we talk about mental health, we make sure that we're talking about our own, the people that we love. We're not talking about disordered mental health.
Yeah.
We're talking about the fact that we've all got it.
Great. Okay, so what's the best way to switch off after a big job that keeps maybe rolling over our minds even months later? And what are some of the things that you do to respond to a big night where there's been some heavy stuff going on out there in the chill out zone?
How can
we process that?
I think we've probably all got quite individual ways to do that. I know we get so busy in the chill out zone that I do tend to think the next day, or I'll randomly remember someone and go, oh, gosh, what happened there? How did that turn out? We try and make sure, particularly if it's a critical incident, that we talk to each other before we leave, because and most paramedics would find the same. It's very hard for people not in that environment to understand some of the pressures in that environment. So think about ways that you would normally cope. Like, I'm not going to go for a morning run, but there'd be lots of people that would go for a morning run, and that would help them. Spend time with babies. I really encourage the staff in the chill out zone, because we finish it around about the right time. Go look at the sunrise. It's glorious. It's a new day. There's new possibilities. To recognise that the people that we deal with are on their own journey. And, as long as they've survived, that is an addition to their journey that we can hopefully support them to learn positive things from. If we're talking, months and months later, then we are probably talking about trauma that needs to be addressed medically. One of the most difficult things for any first responder in any service is people who do not survive, and that is, I guess, probably one of the most difficult things to deal with. The other probably being if you didn't do what you thought you should do when you think about it later. And it's really important then to acknowledge, that it's a pressurised environment, that you did the best that you could. If that is a persistent feeling, then go and talk to someone, whether it's your supervisor if you're comfortable with them, or a medical professional. But I think, again, that's going to be a really personalised thing. If it's going over and over in your head, why? Do you think you did the wrong thing? Do you feel for that person? Because the reality is, if we're choosing a profession where we're going to come up against over and over the same sorts of issues, we will burn ourselves out if we worry about each person's life trajectory after we've dealt with them. Yeah. One of the most challenging things in the chill out zone is that we try really hard not to find out what happens, because sometimes we probably don't want to know what's happened once they've left our care. There's lots of times that we do, and it's probably a really happy story. So how do you make peace with that? And that's part of being part of a team that agrees with the same philosophy, and trying to wind those things up as much as you can before you leave each other's company, and then to go and look at what is beautiful in your life that gives you hope, where you can say, okay, now I can go back and do another shift. And I think maybe picking the person that you want to tell you when they think it's becoming an issue.
Yeah.
That you've got someone that you can trust, that when they come to you and they say, oh, man, you're not letting this go, I think we need help. That you've agreed beforehand that, yes, you trust that person enough to do that.
Yeah. Okay. They know you well enough and you trust them and, their opinion. That's great. What's the best thing I can do for a friend who may be suffering mental health challenges?
Don't judge them and ask them. That because that's what reduces stigma, that we're not being secretive about this. So if they're undiagnosed, you obviously can't say, what's your diagnosis, but where are your concerns? So you never come out with us anymore, but you don't want it to be you, because if they are not feeling good about themselves, then it sounds like you're attacking them.
Yeah.
So make it about I. You don't come out with this anymore, and I really miss you. You're so much fun to go out with. You play the piano so beautifully. I've noticed that you don't play anymore. Is there a reason for that? So whatever the behaviour of concern is, think about why that's a concern to you. Don't start things that you can't finish. So, if you're at a bus stop and you're about to catch buses going to two different places, that's not the time to say, so what's going on with you? I've got to get on the bus now. Try and set it up so that you do have time because if the answer is what you're concerned about is correct, then you're going to need time to be with them to make sure that they get assistance, so that the pressure doesn't solely sit with you. Who else do you trust? The most important thing is that you're safe. Who else can we trust to bring in on this? Because what you're telling me is you don't feel safe. If they're suicidal, you don't feel safe. Who else can we tell? When it comes to suicidality, though, that's obviously the most serious and the most likely to have a tragic outcome. So try not to leave them until you have a plan, or until you're able to get them to a health professional, which could be on the phone, where they will actually go through a series of steps. And when it does come to suicidality, never, ever be afraid to ask, would you harm yourself? Is that something that you're thinking of? That would be devastating for me. How can I help to keep you safe? If it's, there will be some mental health issues that make people really resistant to suggestions that there's something wrong with them, because that's just the nature of their mental health problem. So some personality disorders would be mortified if you brought up the fact that there's that they're acting a bit strangely. So I think about what is it that you're seeing that's concerning you. Try and find out information about it. There may be a really simple explanation. They may have had an online lover that hasn't spoken to them in a month, and it's actually just a natural grieving process because they've been ghosted. But it's always nice to share those moments with our friends as well. Or it could be the sign of something more deep-seated that does need help. And I think to approach that non-judgmentally, wow, do you know that 50% of Australians do have this issue, almost 50%, across their lifetime. Have you seen anyone about it? Do you know that there are great treatments for it? Do you know that this helps with that? Why don't we go for a walk together and we can talk about it on our walk? So I think, if you're concerned about someone, particularly if it's someone that you have a personal relationship with, use the fact that you care about them. Come from that angle. I care, and that's why I'm asking. So if they're doing things over and over again that really annoy you, like not turning up when they say they'll turn up, or don't use those moments when you're cranky to start that conversation.
Good point.
Take a step back and take a breath and just go, no, this isn't right. And be prepared for the answer, whatever it might be, and to take the time to make sure that they're safe.
Awesome. Amazing. Well, Angela, I think we've covered everything we wanted to today, and I'm so thrilled that we got the chance to talk about this. Thank you so much for giving your time to come in today.
Oh, thank you. I'm very
in
passionate about it.
Yeah.
And I'm also really happy, if we get a good response and people are interested, send in your questions. We can do another one.
Yeah.
Where
awesome.
we really specifically say, okay, this is what's shaping the students that are watching.
Yeah.
This is what we want to know. And I think probably the last message that I would have for them is, this is clearly an environment where your well-being and mental health is important.
Yeah.
Take advantage of that. Over the next 20, 30 years, it will become important in every environment that we go into. But it's wonderful that here is an institution that's willing to support you, that wants to hear, that wants you to succeed primarily, but wants to hear. If you have difficulties along the way, that is actually set up specifically to be able to help you. So absolutely. I think that's wonderful, and take advantage of it.
Absolutely. And of course, we've talked about some pretty heavy issues today. If this has raised anything for you, any concerns or issues for you listening, obviously we've talked about some of those ways in which you can get help going to your GP, but what are those immediate services, community services that people can reach out to right away if they want to talk to?
Phone-wise, we've got 24-hour hotlines, Lifeline, Beyond Blue. We can make sure that those numbers are accessible as well. I'll pop up some of those, longer-term resources that are apps and things. If it's an immediate thing, try with some of those phone hotlines.
Yeah.
If it's really serious, present to your nearest emergency department.
Yep.
If it's not as serious, ring someone that you know really cares about you. And one of the things that when it comes to people being triggered by conversations or situations is because they're not taking care of that, or they haven't taken care of that before.
Yeah.
So it is actually a really healthy indicator that there's something that needs our attention. And when it comes to mental health, if it's waving at you madly saying, pay attention, pay attention, pay attention.
Good one. I think it's a great place to finish. Thanks, Angela. Thanks again.
No worries.